I am down in Florida and I just wanted to give an update on my implant journey. I had my procedure done in June of 2022. I had 5 implants placed on the top and 4 implants placed on the bottom. When I went in for my 1-year cleaning, we noticed that my upper implant, I believe it's number 13, failed. And it didn't fail where like there was infection or any symptoms. Honestly, had no idea until I went in and we did a torque test and it failed. It also failed the tap test. That's where a metal instrument is tapped on the implants and it makes a distinct sound. It also feels kind of sensitive when they tap it. So at that time, I believe that was, I want to say December of 2023, that implant was removed and a new implant was put in the same exact spot. Since there was no infection, there was no bone loss, we just put a new implant in that spot and my bridge was put back on. Another year later, I went in for another cleaning. So this was December of 2024. I went in and my bridge was unscrewed and same thing, we did the tap test. It made a certain sound and it was sensitive. It kind of took, but at the same time it didn't. And again, no infection, no pain, no symptoms at all. It just didn't fully take. And I believe that it's just the way my bone is. Since I had all of my teeth removed and I experienced some bone loss, for some reason my bone was just like very, very dense and hard. So I think that just that spot never fully integrated and it just was really, really dense. I don't know. But in December of 2024, we decided to remove that second implant and put some bone grafting in there and then just close it up and let it heal and get another implant later. So we did that. We put my bridge back in. I just had to be careful on this side since I no longer had the support from that implant. I just needed to make sure, I didn't chew anything too crunchy or hard on that side. Fast forward to now. It is March and I had surgery on Monday. So I had a brand new implant put in that spot. The bone healed really, really well. The graft took and the implant is in there like solid. So that should heal with no issue and that should be the end of having an implant replaced. So I just wanted to just kind of talk about the whole experience. And for me personally, I know that this used to be my biggest fear around getting dental implants, was having an implant fail or all of them fail, just because I have such a traumatic history with having dental work in general. All throughout my teenage years and early 20s, it was like one thing after another and everything would fail, get infected. It was just issue after issue. So I was really afraid to get implants and experience the same thing. But honestly, it's been so much easier than I expected. Like, having an implant removed or having an implant put in takes minutes. It's super quick, it's painless, and it's just the easiest procedure you can have done. I know it seems super scary, but honestly, it's super simple. And when you have a talented surgeon that knows what they're doing, it's really no big deal at all. Each time I had this surgery done, and I say surgery, but honestly it was like a really simple procedure, I was numbed up like you normally would be for any kind of dental work, and then implant is removed, which takes seconds, and then the area is all checked out, and then a new implant is placed or some bone grafting is done. Which bone grafting, I know that also seems really scary, but honestly they just take, it looks like powdery little granules and they pack it up in there and then they stitch that area closed. Again, takes minutes. You don't feel anything. There's maybe a little bit of soreness afterwards, but all of that is really no big deal. It was easy. But yeah, so I just wanted to talk about my experience because, you know, this happened to me several times where I had an implant fail, and I'm okay. I have my teeth. Everything's good. The most important thing when looking into having this procedure done is finding someone that knows what they're doing, that is experienced, that offers a warranty, that stands behind their work, so that if something does go wrong, something fails, they will fix it, they will replace it, and they will make sure that you are taken care of. And you can do that by, you know, researching the doctor that is doing the procedure, reading their reviews, whether that be on Google, Yelp, Better Business Bureau, researching other people that had the procedure done at that location. There are several Facebook groups for dental implants where people share their experience, where they've gone. You can look up videos on YouTube and see where people went and how their experience was. So that is just the number one most important thing. You want to go somewhere that is highly experienced and they stand by their work. They'll take good care of you if something does go wrong. Because honestly, this isn't like a one-time procedure and you're done forever. There is maintenance with this. There are things that can go wrong, and they do go wrong, and you know, it's not uncommon. You know, sometimes implants just don't take or they fail. Sometimes zirconia can crack or chip, especially with people that grind their teeth or have bruxism. So these things can happen. It's so important to go somewhere that especially offers a lifetime warranty, because then you're covered for life, whether that be, you know, you pay once a year to keep that, or you maintain the warranty by going for your cleanings. You want a lifetime warranty because, you know, even if you don't use the warranty and you never have any issues for the first 10 years, what if 15 years down the road you start to experience issues, or you know, maybe you need implants replaced or you need new bridges made? Under that warranty that you've been paying all that time or going to your cleanings for, you'd be covered. So this is definitely something you need to think about long term, but with the right office, with the right doctor. If you're in good hands, you don't need to worry or panic. Any office that says that, oh, this will last a lifetime, zirconia never breaks, zirconia never cracks, these implants will never fail, I wouldn't trust them, and especially if they don't offer some kind of warranty or, you know, stand behind their work. I would not go to that office. You want someone that's going to be honest with you. Failures can happen. Things can crack, things can break. So that pretty much sums up everything. Right now I am in a temp on the top. So this is just like a 3D printed material, and on my bottom I do have my zirconia in. So you can see how they're different. Usually temps are printed like the same type of shade for everybody, so this is just like the standard shade for temps. My finals are, I went bleach white, so they do look very different. But this is just a 3D printed material. We scanned that in today, and I will have a new zirconia bridge delivered on Friday, just because with this new implant, the placement is different than I had before. So the zirconia bridge I had in previously would not line up with that. So I did need to have a new bridge made. Regarding restrictions, since all of my other implants have healed, they're fully integrated, I don't need to be on a soft food diet or anything. I am just going to be a little cautious, you know, on this side. For the next 3 months, I'll avoid chewing anything like jerky, steak, anything super crunchy or chewy, just because I really want this implant to heal good. and I don't want any further issues. So I am going to be cautious. So yeah, things can go wrong, things can happen, but as long as you have a good surgeon, you have a good team, you know, you'll be in good hands. Just because something fails doesn't mean it's the end of the world and, you know, that's it. My previous failed implant, I was able to keep the same zirconia arch with the same exact placement. This time around, the implant placement is different, so I did need to have a new bridge made. Stuff can happen, but as long as you're in good hands, it's okay.